We are back with an interesting topic today, myths in pregnancy. Something all the time we have a discussion about, or we get asked time and again, almost nearly 20 times a day. And I'm sure you guys have all these questions as well. What should I eat during pregnancy? Or should I eat this? Should I eat that? Or my parents said this, or my in-law said this, or my neighbor said this. There are lots of cultural variations of food habits. So that's something that we always take into consideration. But generally, overall, it is the quality of food and the quantity of food that is encouraged. The first myth, there is widespread prevalence of this myth. Should or can I take papaya and pineapple during pregnancy? There has been research done and it's actually okay. They are just fruits. Again, quantity is important, but you can eat them. There is no restriction. But please, if you've got cultural restrictions, go back and discuss that with your family. But medical point of view, you can eat that. Moving on to myth number 2. What is it? Oh, you're pregnant. You should eat for 2 people. How many times have you heard that? N number of times. But it's not that. Your average weight gain during pregnancy should be 12 kilos from the time you fall pregnant up until you give birth, because otherwise you're going to struggle to lose weight after you give birth. So for an average BMI, that is the advice that we generally provide. So to maintain that weight gain and to be able to lose the extra weight that you gained, what do? Please don't eat for 2 people. It's just you need about 400 to 500 calories extra per day along with your regular diet. So that is all is needed. But that again has to be a healthy choice. Doesn't mean you eat chocolate or cake. No, not that kind of calories. Again, eating healthy is very, very important. And exercising, I think I've said it many times, but this eating healthy and just increasing the calorie quantity by just about 400 to 500 is more than enough to maintain that ongoing supply for both your own body needs as well as your baby's needs. Myth number 3. Can I eat nuts? Can I eat eggs? Can I drink milk? As long as you're not allergic to any of these components, definitely you can continue to have them during your pregnancy. This does not necessarily make your baby allergic to these things. So only criteria is you should not be allergic to them. Again, going back to the same thing, quantity is important. Also, just general warning is avoiding soft cheeses, soft serve ice creams, or raw meat, fish, poultry, or eggs which is not cooked. Preferably avoid them. But otherwise, you can continue to eat all the items that we've just discussed. And like I said, as long as you're not allergic to it, it's fine to eat them. Myth number 4. How many times have you been told, you're pregnant, stop exercising? No, that's not true. If you have been exercising up until the time of your pregnancy, and if the pregnancy is progressing reasonably well at the moment, I don't think there is any need to stop exercising. You may need to modify the exercises. You may need to bring down the intensity of the exercise until you can adjust your body and tolerate it better. That will also depend on your own body symptoms like morning sickness or tiredness that the pregnancy is throwing at you. But please do not stop exercising. You can shift to simple walking or walking in water or something like that. But there is absolutely no need to stop exercising. So please continue exercising and under the guidance of your healthcare professional or your gym trainer, but continue to do that. Many times people have asked, or pregnant women have asked questions like, can I go to the spa? Can I have a warm bath? So yes, warm showers are fine. It shouldn't be too hot. Again, a lukewarm bath is fine as well, but please not a hot one, because we don't want the core temperature of your body to go higher than the normal core temperature. So that's what you need to be mindful of. But otherwise, simple, quick, warm shower or bath is still absolutely fine to do so when you're pregnant. Because during pregnancy, your body temperature naturally goes up slightly, a couple of degrees higher than what it is for non-pregnant women. That's why we advocate this kind of advice. Myth number 6. Are you going to find out if it's a boy or a girl? How many times you've been commented when they look at your tummy, oh, your tummy is slightly low, maybe you're having a girl. Maybe your tummy is slightly high, maybe you're having a boy. Oh, lots of heartburn, your baby is having lots of hair. I'm not sure about those things. They're all general comments. It's fun to hear. But if you really want to know further more than that, we do have options of a blood test or an ultrasound scan to confirm. But again, until the baby comes out, nothing is 100% certain. Remember that. The blood test is only 99% certain. And of course, ultrasound, there can be some fallacies in ultrasound as well. Yes, they tell you what they can see, but remember, wait for the birth to confirm the gender of the baby. The blood test can be done between 10 to 14 weeks if you'd like to find out about the gender of the baby. And the ultrasound scan, it's usually performed around 20 weeks, where the gender of the baby can be discussed with the sonographer. So that's your two options. But the rest is all just fun and games during pregnancy. So if someone comments something, say, yeah, maybe, and you can take it in your stride and enjoy the pregnancy. So I hope you enjoyed the video of myths on pregnancy. I quite enjoyed doing that. If you would like to discuss about anything further other than the myths in pregnancy, you're more than welcome to see us at athenawomensclinic.com.au or your own healthcare professional. Good luck with your journey. I'm Dr. Kavipriya Soma, a GP with special interest in women's health. Thank you for watching.